Hello everybody, greetings. We are here to discuss about the managements and the controversies which are going on today regarding Ayurveda and modern medicine in this pandemic COVID 2019. Basically, when we see that Ayurveda, modern medicine, homeopathy, Unani, yoga are some of the allied medical sciences. Unfortunately, it is said allied, but here Ayurveda, homeopathy are also the main medical systems of medicine which are practiced all over India, which are even practiced all over the globe. It is very unfortunate that Ayurveda is every time given what we can call as a second place in the system of medicine. Though it has been originated in India, we Indians, we don't have any proud about it, about this science. Specifically, many people, they have an opinion that Ayurveda is not a science. Many people say that it is a pseudoscience. I don't understand. And when I visited Wikipedia, it was said that it is a pseudoscience. I don't know what is a pseudoscience. But I also really believe that Ayurveda is not a science. It is not at all a science, but it is eternal. It is the Indian for the it is a wisdom for the Indian medical fraternity, actually speaking. So science, when it comes to the word science, science has to be proved now and then. The theories, the what we call the principles have to be proved at every stage and every step. And when it comes to Ayurveda, whatever the principles which are promoted since thousands of years together, they are all eternal. They can't be changed at all. They were true since thousands of ages, thousands of years, and they will still be true in the coming thousands of years. So there is a lot of difference between a science and Ayurveda. Ayurveda is really eternal and it should be taken as a wisdom, what I feel, as a to treat not only this pandemic disorders, but treat all the non-communicable diseases, to treat the metabolic disorders, to disorders like cancer and all these things can be treated very nicely if we take help of Ayurveda. So every system of medicine has its own limitations, has its own pros and cons, and everybody should accept that these are our limitations, these are our pros and cons, and up till this level we can work. Beyond that we can't work. So if these limitations are accepted by the medical fraternity actually, then the problem solves. Many a time it is felt that modern medicine practitioner, they feel that only modern medicine is the only medical system in the world which is existing. And it is not true. I know, I agree that lot of research work has been carried out since 100 years to develop this modern system of medicine. Modern system of medicine has taken help of physics, they have taken help of allied sciences like chemistry, biology, basic sciences, biochemistry, molecular biology, epigenetics. All this comprises of modern medicine. No doubt with the help of modern medicine, the life expectancy of a human has definitely increased. But it doesn't mean that it is the only medical system in the world which is existing. But when we see in the society that people, they behave like that this is the only medical system and all others are, they're not working properly, or they don't accept other systems as a medical system. I don't see any Chinese doctors, Chinese medical doctor who disagree about the Chinese medicine. Then when it comes to India, majority of the people, modern medicine doctors, they disagree Ayurveda. They are not aligned with the principles which have been elaborated by Ayurveda. And what I feel personally is that the problem is not with the person. It is a system failure. The system has been developed that way. The upbringing in the education field of medical has been done that way, that the students at an undergraduate level, they are made to thought in a manner that only modern medicine system is the only medical system which is existing. And that's the main reason why people disagree from the medical fraternity. People disagree, maybe Ayurveda, maybe homeopathy, or maybe other allied medical systems. Looking towards the Indian pharmacopoeia, in this year of 2021, we come across many herbs where the monographs or where the dosage form they have been elaborated very nicely into Indian pharmacopoeia, which has been accepted by modern medicine, which has been elaborated by modern medicine. A very perfect standardized dosage form has been mentioned. The standardization values has been mentioned. Nearly 50 to 60 herbs like amalki or like triphala or like piper, like licorice, like aloe, then castor, all these herbs have been clearly mentioned in Indian pharmacopoeia. So it means that the modern medicine in India has accepted these herbs as a medicine. Their pharmacological activities has been elaborated very nicely. And so the acceptance up to the pharmacopoeia level is there about the Indian herbs. So their use can't be ignored. Basically, when a person is using, for example, ginger or pepper to alleviate cough, then doctors should not tell that, okay, this is a herbal medicine, this is a fake and quackery. Because it has been mentioned in Indian pharmacopoeia, it is actually, I feel personally that each and every practitioner in India should be aware of these Indian herbs and their activities and their pharmacological action. This is so because Ayurveda has been inherited into the Indian families since years together. It's very important. Whenever there is certain elements are coming into the families, people try for the first aid. And as per the WHO data, majority of the people, they take help of herbal medicines to prevent the disease or to cure it at a first stage. So these are also mentioned in IP. So this should not be ignored. This is one of the important things because this has been accepted by the modern Indian pharmacopoeia. The another most important thing is that these herbs should be known to the modern practitioner because these herbs, they have a very great interactions with modern medicine. At least for this sake, it should not be ignored, what I feel. Many herbs, they have lot of interactions with modern drugs, and it's very unfortunate that modern medicine doctors, they are not, even Ayurvedic doctors, even homeopathy doctors, they are not aware of these interactions. There are many positive interactions, there are many negative interactions also. But when we come into this, when we think about this pandemic, COVID-19, these interactions, these positive interactions can help a lot to prevent the further stages of the disease. These interactions can be very helpful to reduce the doses of the of antibiotics or maybe steroids or maybe anti-inflammatory drugs. These medicines can also come to help to reduce the doses of biologicals and immunosuppressants. There are many examples, and I am very fortunate to see that since near last 40-50 years, many modern medicine practitioners or researchers who are coming from modern medicine or who are coming from basic sciences, they have worked a lot on the pharmacological activity of these herbs. People coming from molecular biology, people coming from biochemistry, even people coming from dentistry, they are working a lot on the herbal medicines. And when we saw that, now for example, I'll give certain examples. For example, paracetamol was advised in a little bit higher dose to relieve fever in this COVID-19 pandemic. Now, if we use licorice along with paracetamol, definitely we can reduce the hepatotoxicity of paracetamol in COVID-19 patient. Already on one side there is a cytokine storm, and in cytokine storm liver plays a very very important role. When, because CRP is increased, and when these drugs like paracetamol they induce hepatotoxicity, then medicines can like licorice can reduce the hepatotoxicity of paracetamol, or it can be used very freely along with licorice in patients who are having impairment of liver. For example, they have a fatty liver, they have a alcoholic hepatitis, they have a cirrhosis of liver, or any other liver problem where paracetamol can't be used in a very higher dose. Along with licorice, definitely it can be used with higher doses. A second very good example, again we will take with licorice only, that the glycyrrhizin which is present in licorice, it resembles with the chemical structure of steroids. So whenever we have to increase the dose of steroids, specifically in COVID-19 patient in the moderate or severe stages, definitely what happens is that along with, if it is administered along with licorice, it happens that way that the doses of steroids that is required will be very less. And if the less dose of steroid will be working at this point along with licorice, then the further post COVID complications will be definitely come under control very nicely. Secondly, there are certain herbs like Enterographis paniculata or Ocimum scantum or Dinospora cordifolia or Withania somnifera. There are certain these type of herbs, they also have an activity on interferon gamma. They increase interferon gamma level very nicely within a span of 8 to 10 days. In the last wave of COVID-19, we have researched a lot on interferon gamma with these herbs, and we have seen promising results on the humans. Even also, we are the first people to go for the acute and toxicity studies of certain herbs which have been claimed by Ayush. And they have proven to be very safe medicines. And if such type of medicine which are going to help to reduce the doses of immunosuppressants or biologicals, or which are going to reduce the dose of steroids, or which are going to reduce the dose of anti-inflammatory drugs, then definitely these interactions should be considered. What I feel, they should be considered by all the practitioners or all the treating doctors who were treating COVID-19. This would have helped to reduce the toxicity of the medicines, to reduce the untoward effects of these medicines, to reduce the toll on the patient, to reduce the cost of medicine and the toll on the health system. So this would have reduced very nicely, but it was very very unfortunate that these type of researches which has been taken about the interaction, these type of researches about the herbs which are known to have an immunomodulatory activity, these were not considered at all. Then what was the use of these researches from last 40 years? And I again repeat it, that these researches were not done or not conducted only by Ayurvedic personalities. They were also conducted by modern medicine personalities or basic science personalities. That was so there was no problem in believing those researches. They were up to mark researches, but they were not considered. So what I feel is the money which was been utilized for conducting this research, that is wasted if it is not used in such a pandemic. So that was one of the important thing what I want to tell. Secondly, as I told, that every system of medicine has its own merits. Ideally speaking, delivering the medicine is not the main aim of Ayurveda. That if any ailment, the patient comes with any complaints or any ailments or any diseases, only just giving medicine is not an Ayurvedic practice. The main merit of medicine, the main intention of Ayurveda is that we have to first prevent the disease, or if prevention is not possible, then what we have to do? We have to treat the disease. So first comes the prevention, and then we have a holistic approach. So how the holistic approach is there? Here the merit of Ayurveda is in the lifestyle, in the dietary control. These are the two main important tools of Ayurveda where modern medicine is lacking today. That the dietary measures elaborated by Ayurveda, the lifestyle elaborated by Ayurveda to prevent this pandemic COVID-19, or the dietary measures which are to be advised to the patient in the prevention of the disorder and the cure of the disorder, not only COVID-19, but the dietary measures which are to be considered to even cure mucormycosis. That was also not advised to the patient. Now, ideally, giving medicines of modern science and advising diet controls which has been elaborated or with the help of Ayurvedic principles, there should not be any controversy. But this was not also accepted. There was no protocols given to the health workers or given to the doctors by the system regarding strict dietary measures in mucormycosis or in COVID-19. Now, if we see that why people landed into COVID-19 or why people landed into mucormycosis was all about the inflammatory process into the body, about the initial low-grade inflammation in the body. The mucormycosis, it was due to the glycation effect on the tissues. Low-grade inflammation, these are the basic pathologies which create this type of disorders. And whatever the diet has been elaborated by Ayurveda is totally controlling insulin resistance, is totally controlling inflammation at a cellular level, totally controlling glycation or reducing glycation at a tissue level. And if such type of diet would have advised at a mass level, then definitely the requirement of the medicine would be definitely very less. So it was very unfortunate that this was not advised very correctly. So, as I say that diet and lifestyle has nothing to do with the drug administration, but they will definitely improve health status of the patients. But this was ignored. So this means the difference in two system of medicine is totally different. That the first system, that is modern system, is having a reductionist approach. Ayurveda is having a holistic approach. If we can club these approaches of two different system of the medicines, then definitely it would have helped the patient to treat very nicely. Secondly, if these diet controls would have advised to the patients very correctly, then the cost effect of the treatment would have gone very down, and this would be a very, very soothing effect on the patient who suffered, whose families and all the members of the family suffered through COVID-19 pandemic, who have lost lakhs of rupees. The most important thing, what I feel again, is about the vision of Ayurveda looking into it. Now, looking towards the first wave reciprocally, or looking towards the second wave, looking towards the analytical data, the most important thing what we should see now, that for example, certain members of the family, they suffered in COVID-19 and certain members, they didn't suffer in COVID-19. It is now very important to look why some members, they did suffer. They were not having RT-PCR positive. They didn't have RT-PCR positive. What was the reason behind that? That is to be analyzed very correctly, and the answers can be given very correct with the Ayurvedic theories and Ayurvedic principles, that certain peoples, they suffered and certain peoples, they didn't suffer. It is not only due to immunity, what modern medicine can tell us. It is not only the immunity which has helped, but there are number of micro-environmental factors into the body at a cellular level, at a tissue level, which has prevented COVID-19 complications in certain patients, and certain patients landed into those complications. So these answers can be taken from Ayurvedic principles. Taking the discussion at a next level, that when we come to the now, because everybody needs a data, when we say that we have treated such amount of patients of COVID-19 and these were the medicines given, the first question asked is, where is the data? Nobody is having the data now. Because it was all pandemic, everybody was panic only treating the patients and relieving the symptoms and signs of the patients. So data was not already actually collected. But if we go to some next stage, that Ayurvedic principles and Ayurvedic managements, actually when it comes to research, they are not fit. Or what I feel is that the whatever the statistics, medical statistics we are applying, it is not fit to explore Ayurvedic principles very correctly. Ayurveda solely depends on personalization. Ayurveda believes in personalization and customization, and here in this era we go with the generalized research and not pragmatic research. Actually, Ayurveda needs a pragmatic research and not a generalized research. And when we go to the pragmatic research, or sorry, when we go to the generalized research, whatever the expected outcome out of the statistical parameters should be there. That can't be elaborated. That can't. The expected outcome will not be there. And then what we feel that because we calculate the results as per the statistical outcomes, and here we will not get the expected results. So basically, the modern research methods are not fit for the Ayurvedic research, and that should be taken into consideration. That's very, very important. Next thing, what I feel is that if people from modern medicine, people from basic science, they come and make a hand-to-hand research along with Ayurvedic people, that will be a really, really very helpful for the mankind and treat the further pandemics. Because now the era will be of the viral era. Now the bacterial era is going. Now the era is a viral era. So we don't know that after 5 years or after 10 years which pandemic is going to come or which viral outbreak would be there. So we should be totally prepared for the coming things. And basically what I feel, these two systems will be clubbed together, because of the level what we are working, we are not concerned this is modern medicine or this is Ayurvedic medicine. We are not concerned with that. We are concerned with the management and giving the results to the patient and preventing the not only the our patient but preventing the societies and the cities from these pandemics. So these type of studies are required which can help the people to prevent the disease. At last, I'll quote some quotation from Prince Charles that the whole imposing edifice of modern medicine is like the celebrated Tower of Pisa. It is slightly off balance. So what I feel is that Ayurveda can just make the things very balanced if we club together very nicely, and there will be no controversy that this is Ayurveda and this is modern medicine if it is accepted as it is. Thank you. Thank you very much.